Hi, community. I'm Prajal from Medic. I primarily work in Nepal with CHT projects. So today I'm going to present on CHT and eHMIS integration. Both are two of the biggest healthcare tools used by Gandaki province in Nepal, which like has almost like 15% of the total population of Nepal. Currently in Gandaki, we have like our CHT app being used by more than 900 health facilities, and like we also have a SMS form based model that is present there. So we run a hybrid model. You can enter data from app as well as SMS, which is used by almost 6,000, more than six, I think it's almost 6,000 FCSVs. Okay, in this project, the main stakeholder is the Gandaki province. So every tool that's being developed is being developed for them. eHMIS is a proprietary tool. It's developed by Code Vision, local developer company in Nepal. So after this integration is done, right, the roles that are divided in this way, all the HF related data will be collected in eHMIS, and all FCSB related community related data will be collected by CHT, if by FCHBs, which for which they'll be using the SMS forms, which I'll explain later. I'll just like to give a brief overview of eHMIS. So basically, like every country has a HMIS toolkit list, right, or register, right, to collect healthcare data. So eHMIS simply digitizes what's on paper so that it's much easier, faster, and then um, highly interoperable or integratable with other systems. So rather than like taking notes in paper, then putting it out in a particular format in a form and then pushing it to DHIS2 or something, it does all the thing in one software, and then in one click it can be pushed to DHIS2. So that's the problem this solves. So yeah, basically almost what I mentioned. One thing we can add is like due to its being digital, like it's helping a lot with data accuracy and data validation. On top of that, like the cost of having eHMIS on any HF is like the cost of the paper that was previously used to record the data itself. So it's huge cost savings. So HMIS basically is made by the government. It's like a guideline. So all these forms that are in HMIS are based upon a guideline, which I can show you later. The list of forms, there's a huge list of forms. CHT and HMIS integration will only focus on maternal and child health forms. Currently, it only supports Nepali, but I asked if they will be open to globalization, and they said yes. So these are basically some of their achievements. We are also pretty amazed. Like they have like 2,000 health facilities covered in, I think, 3 or 4 years, and we have like a verbal agreement to like integrate in every province that they are present if we have the same presence as well. So which is great for us because we'll have more data and complete data in the long run. Mm, Other thing that they're trying to do, I guess, is like they have small data analytics parts incorporated, like we have like Medic Analytics and Superset. So they're trying to do the same as well. We might work with them in the future for that, as well as like for interoperability. I think there's another. Okay. Yeah. So I was really happy to like, look into this. So they follow all security standard of OWASP, and then there's like SSL, there's cloud-based data storage. They even have like data disaster recovery and horizontal scaling, which is great. So they have like one server here, and like the other cloud server is in 200 kilometers away. So, and they have even in the same service, they have like multiple load balancers and nodes, as I've been told. So their availability is really high, unless the internet goes down in Nepal. Okay, so basically, like, I would like to start with what was the actual need, right? Why do we even need to do this? So eHMIS and CHT being on most prominent tools in like Gandaki, HF had like a big problem. They had to store the same data, the person registration, pregnancy, ANC, delivery, PNC, in like two different systems. So it was a big hassle for them for their time, as well as like reporting, like doing collective reporting. So Gandaki province asked us to like integrate these two together so that each would have their own niche and they could work together in the same time. So that was the biggest need. This would further like help us in data completeness as well as uh, collection convenience. Yeah. Okay, so I think many people will be looking forward to why it's an integration work versus going the interoperability route. So given the time frame, we are like only first it was proposed that we'll only have 6 weeks. Then it was extended to 2 months. So integration was much faster. Uh, it was less complicated as well to integrate. And then, like I said, limited time and urgency. So we do have like mediator, which is fire compatible to an extent, and we could have used that. But then eHMIS is only looking to support fire compatibility in the near future. They said around 6 months. And again, then if you had used like fire resources, we'll have to work on standard codes to share our healthcare data, right? So it would take a long time. We're always open to it. Like we're always open to it. We're actually planning to have a meeting with them. They have personally asked us to take our experience in fire and open MRS and like these healthcare codes so that we can make a more interoperable system in the future. So I'm actually looking forward to it. Mm. So the other question that might arise, like we already have a CHT API, right? Why would we do a lot of things in a mediator? Although like, so one of the major reasons was like CHT, I believe, um, has a more generic API, right? But with the help and the power of mediator, what we could do is like make more tailored or specific APIs for the particular deployment, right? The data, let's say if you have a pregnancy data, right? The data that comes out from the report in CHT API versus the data that we can get from the mediator, we can use our own logic, etc., that's needed for the particular deployment, right, from the mediator, and then send it to eHMIS. So mediator allowed us that flexibility versus adding like more APIs in CHT. So that's why we took the mediator out. And also like I would argue both can support fire in the future, but it'd be easier to tailor only a particular like a few requests that are in mediator to be fire compatible versus like all the API and CHT to be fire compatible. So that is the other reason. Okay, so like we need to have a particular key or like particular way to share data, right? So we both agreed that in both our systems we have the FCHV female community health volunteers number and the patient's phone number. So all data that is being exchanged by these two numbers. There are like particular patients that fall under each FCHBC area, and they are responsible to report on all the pregnancy, ANC, delivery, PNC, and other healthcare records that are assigned. So we chose that. Basically, how the integration goes is like at first we create a patient profile, right? In initial sync, we create a patient profile that will have all those aforementioned data, and then it will be passed to eHMIS. It's a pull system. eHMIS would pull the data anytime the user in eHMIS logs in and goes into a particular health facility. And for newer data, what would happen is that anytime they get newer data, they would send us a request in our mediators API, and then we'd get the data. There'll be like multiple times, there might be cases where like the FCHB details, SF details, etc. might not be synced or like same in both systems. So we'd order to like currently manually check every month or so, and then make those data more correct or complete. To understand the next demo, I'll give a brief overview of our SMS forms concept. So it's easily understandable how we collect the data in app, right? But in SMS, we cannot have those long forms and as such, right? So in SMS forms, what we do is like we have initially the form codes, the NLPG, right? Those are the form codes. That's how CHT understands which type of form is it. So N is the new person registration. And if you type like N, age, phone number, and name, and send it to our current like the demo environment, it will understand that you're trying to register a new person. Similarly, for pregnancy registration, if you put L in the front, it will think that that's a pregnancy registration form and it should have those fields. So in same way, if you put the pregnancy registration's code L and then give the patient ID and this BS year, BS month, and BS day is like Nepal has its own calendar and we call it the Bikram Sambat calendar. So we use those dates, but when we put it in the system, we convert it to epoch, so it's easy to convert into any AD or anything if necessary. So this is how basically SMS form works. So you can see the message examples in the right. For the demo, let me share my screen. So CHT has one cool feature, like to send a message, I can just directly send a message from the web app itself. So I'm going to use that feature. So for this, I'm going to create a new user. So this is like n means new user of 20 years old with this phone number. We cannot have duplicate phone numbers, so I'll just change the number. CHT live demo. So I'm mimicking an FCHB sending a message to our system at this point. So this is the FCHB phone number, and this is all the person details for new person registration. The report is submitted. Let's go to the report tab. Oh, okay, I think I have the wrong phone number. Yeah, it's a facility not found. Sorry. Okay. So here, like I have a new person, and let me just translate this. Hmm. Where's the translate pop-up? Give me a second. Hmm. I don't know why the translation is not working. So basically, this is like saying the new person has been registered, so we can see their reports. We got a medic ID, right? So any report that we send for this person the next time needs this medic ID to identify that we're sending the report for that person. So yes, okay. So now next, let's send the pregnancy report. Yeah, so the pregnancy report is there. This will be the delivery report. So we're just saying delivery, it's the J form that we need to use. And this is an indicator that says it's in health facility. This is the patient ID, and this is the number of days since delivery that has been done. So we're shortening the message because like it helps FCHBs who are not very digitally trained to not have to input all the dates. Okay. I'll also do the PNC form right away. Right, this is the number of PNC if anyone is wondering. Now we should have like 3 forms, I guess, for this person. All right, so this is the registration, this is the pregnancy, this is the delivery, and this is the PNC form. So next, what we need to do is like transfer this data to eHMIS, right? So how that basically happens is like, first of all, I need the phone number of the FCHP that's here. So that's this number. This number needs to be in the eHMIS system. Okay. So I've translated this in Google Translate. So some of this might not make sense if anyone is looking at it. So we can see the details of health volunteer. This is the form I'm in. So I'll just add a new record here. Like my FCHP. Something was needed there. All right. Okay, I was not logged in. But the session expired, I guess. Sorry. Let's translate this. Let's go back. Add an FCHP. So admit. Okay, just rechecking if it's there. Okay. Now let's go to translate again. So it's easier. And the next thing we do is like, as you can see, like HMS has like a huge number of forms that government has already defined the way it should be. So this is just a basic digitalization of that HMS data collection, but the impact is huge. You know, it helps the HF people a lot. Now next, let's go to maternal and child health. So what will happen is like if you do this sick medic ID, it will get the patients that have just been put there. And after a few seconds, it will have a water drop icon popping here. Yeah. And this will tell all the patients that are in CHT that needs to be brought here. So that's how it works. So after this, the part where all the data comes here is not there yet. So like the eHMIS team is working on it. That's the one we added. Yeah, this is the one we added CHT live. So this is the Nepali date. that we added for like LMP. So what should happen? Like here, I'll tell you just what should happen, right? Next, what should happen is like the patient should be created. They have their own way to create a patient, like we did. So the patient should be created in using this form. I think it should happen automatically. And then after the patient is created, if I go back to the maternal and child health, I can add a new record, and the patient's ID will be able to be chosen here, and then it would fill all these patient details, and then fill the pregnancy, this is delivery, and then PNC records automatically. So they're currently working on this. So I think the last part of this video, I'd like to go through Postman. How would they send us their records, right? I hope this is understandable. So basically, they will give us something like this: all the patient details, and then pregnancy, delivery, and ANC visit details. And I just added a new record. You can see here. So they'll call this API, and then if I go back to, well, yeah, there should be latest reports. Yeah, you can see like EANC, EP. So these these are the same thing as form names. Like we had N for new person registration, L for pregnancy, right? So we are using a new form so that we know that it's coming from eHMIS or like any other external part. We consider it's like external delivery, external pregnancy, etc. So that's how the whole system will function. I think we'll be demoing this next week to the province itself, and then hopefully we can go live very soon. So that's it for the demo, guys. If you have any questions, please let me know.
Just a quick question if someone is wondering or waiting. So Prajwal, is this eHMIS also open sourced or?
Oh, I'm so sorry. Yeah, it's not open source. Like in future, they're planning to make it open source, but I don't know how close is the future. It's not open source currently.